Hi, thanks for choosing Clinic Air. I'm Kamiko, brand representative for Clinic Air and customer since 2012. When I first called Clinic Air, I was suffering from allergies, asthma, and skin irritations. And mold was one of those issues within my home. Craig, I was hoping that maybe you could walk us through the process that Clinic Air takes when someone calls and has any concerns about mold in their house.
Sure. Quite misunderstood by most people, actually. We try to take some of the mystery out of it and we try to simplify it. Generally, people call us over the phone and we have a discussion as to what their concerns or what their problems are as they see it. And given that information, we generally look to come out to the home or the office after that and do a visual inspection for mold or any other factors that could affect mold in the building. And mold's tricky. Sometimes you can't see it, sometimes you can see it, but it's completely benign and non-toxic. Our experts take an assessment of your building, your home or your office, and we determine what the appropriate next steps are. We'll sometimes do sample testing. We'll sometimes do what's called an airborne spore trap test, where we compare the mold inside to the air outside, or any other steps we need to take to do proper testing. We don't do remediation. We just do the testing. If we determine that you need mold and it has to be remediated, we recommend another company separate from us, because the two should be kept separate.
So how important is it for people to test for mold when they start to feel some symptoms of fatigue and headache?
Well, it's very important, and particularly if they're sensitized to mold, and many people are, and many people don't realize that they are. But there has to be some reason behind it. If you have runny noses, or you're sneezing a lot, or irritable eyes, you just shouldn't go out and test for mold. That's not recommended whatsoever. You really need to recognize something in the home or the building that might be causing those inflammations, that might represent mold in the home. So you look for some signs of mold. And generally that's about water. Have you had water intrusion? Have you had a water backup? Do you see visible mold on your floor or on your walls? If you have that, then you want to call in the experts and look at having the building tested properly.
So Craig, you mentioned that mold can be found often in homes and offices. So how can homeowners prevent mold from growing in their homes?
It's really quite easy. Health Canada says that the keys to this type of a problem is clean and dry. If you keep your home clean and you keep your home dry, you make sure there's no water intrusion and everything's tidy, you're going to go a long ways to prevent the growth of mold in your home and the threat that it encompasses.
So thanks for joining us, Craig.
You're welcome.
And if you have any more questions about Clinic Air, please visit the website at clinicair.ca or give us a call.